Hello, everyone. Thanks for joining us tonight. I'm John Flores. I'm joined by two of my colleagues. I'm from Texas.
Hello, everyone. I am Nancy Fan, and I am from Delaware, and I am the OMSS rep for Delaware.
Hi, everyone. My name is Angelique Gallion. I'm an alternate delegate from California, and I live here in Southern California.
Great. Thanks for being with me. Tonight, we're going to talk about a few things. Let me go over our agenda for the night. We're going to discuss how and why we're involved in the organized medical staff section. We're also going to talk about the elevator pitch and also give you a good example of how to do it right. Finally, we're going to give you a synopsis of the last meeting we had in November by the AMA. Nancy's going to first introduce us to the next section.
Thank you so much. I appreciate that, John. First, we're all going to get kind of started about talking about how we got involved in OMSS and essentially why we're here and why we're actually, involved in this section. I, for one, started as the president of the Medical Society of Delaware when I was first introduced to the AMA. And as I was looking through areas that I could be involved in and engaged in outside of just the House of Delegates, actually the organized medical staff section seemed a very natural home to me. By that point, I was employed physician, and I was heavily involved in how employed physicians were represented in their medical staff and making sure our medical staff stayed independent. One of the things that really drew me to OMSS was the policy setting that they were really involved in, and it really helped me decide that this was a natural home for me. So even after my presidency for the Medical Society ended, I asked to be the representative for OMSS for the state of Delaware, and so I'm the chair, so to speak. But I met some really great people along the way, and I would love to have John tell his story about how he got involved, because he was definitely there before I was.
Thanks, Nancy. That's a great introduction to why you're involved. My involvement came a little more organically. I've always been interested in organized medicine and how we can get together and support our colleagues. What I've learned is that the organized medical staff section is so powerful because we represent the whole nation, and we can get together and talk about things and see how other states are doing things and how they're fighting back against big corporations and big government and hospital systems and protecting the individual doctor. So that's what really resonates with me. And I really went through some times myself as an employed physician. Now I'm independent again, but it really helped me get through that time. Now I'd like to hear from Angelique.
Thanks, John and Nancy. Really, for me, it was that transition from the YPS and trying to find a new home inside the AMA. As we all know, it can kind of be a big group to navigate. But one of the best parts about the OMSS is, I think, just like you're seeing here right now, they have these wonderful, experienced physicians who are always willing to kind of share their knowledge and be that person who's your advocate and teacher. The other great thing for me about the OMSS was there were all these opportunities to participate at every level. So sometimes in organized medicine, it can be tricky to figure out, how do I move up? How do I make my voice heard? And the OMSS has opportunities to do that at every level, even just the chance to get to present with you two today.
That's great. Thank you for telling us about that. Something that we developed over the last couple of years is our elevator pitch. And if you've never heard of elevator pitch, basically it's a way to tell somebody within the time it takes to get on the elevator and get off about your section. And we're going to display a little bit what an elevator pitch can comprise. And the first part is really just tells somebody what our section's about. And so you can read through that. In a minute, we're gonna go over it a little bit more in depth. And then it talks about the things we have accomplished. What do you like about the elevator pitch, Nancy?
I'm so sorry. I actually think the great thing about the elevator pitch is it actually kind of really gives you a good idea of exactly what the OMSS does. The beginning of the elevator pitch is really our mission statement, and it kind of guides us about where we want to go. And then how is this accomplished? And there's so many areas like Anjali was pointing to that we are involved in. And so not only does it give the flexibility of the membership of how they want to use the OMSS, but it kind of broadens our scope about who can be involved and who actually encompasses our membership. I think that there are so many important things when it comes to being involved in medical staff that people actually don't realize. So OMSS encompasses that, but can also be so much more, as it shows here. And then actually the accomplishments that we have provided kind of are really good examples of where we have been so essential to helping medical staff be able to stay independent, represent the providers on their medical staff, the physicians and the non-physician practitioners, and making sure that, you know, we as physicians advocate for ourselves in all aspects of our practice. So I feel like the elevator pitch is one way for us to be able to get out there and say, hey, look, if you're looking, like I said, for that natural home, maybe you want to think about the OMSS.
Yeah, and you know, it's nice to have a ready answer when somebody asks you, what are you doing in Chicago and Hawaii and wherever else you go? And I can say, well, let me tell you about the OMSS. And the nice thing I like about it too is you can gear it toward what your interests are. And I think it doesn't matter if you've been a member for, 20 years or if you've been a member for a year. I think it's very readily adaptable. And I think Angelique's been working on something. So Angelique, would you like to kind of give us your example?
Thanks, John. The AMA Organized Medical Staff section is the only physician-led national group that advocates for the independence of the medical staff to ensure that physicians will be able to deliver the best care for patients in a safe environment by serving as a resource and voice for all the medical staffs and their physicians in their interactions with hospital governing bodies. But how did that apply to me? In 2016, I started to get more involved in the medical staff because of what was happening here in California. In our backyard, a board of directors from Tulare, California, voted to terminate their medical staff in what was eventually found to be an illegal move. We watched a hospital in our own backyard close and stop being able to serve thousands of people in this community. It was only because of the work of organized medicine that they were able to fight and win that battle. But how do they do all this stuff? The OMSS works with accrediting bodies and can help with everything from contracting and privileges, even your bylaws. As I walk around the hospital, every issue from NP, PA supervision, quality and safety initiatives, even the hospital beds and operations involve that medical staff, and they all get supported by the OMSS. John, I apologize. I know that was a mouthful, but I genuinely get excited when I talk about it. For all that, I am so excited to be a part of the OMSS.
That was awesome. Great job.
And so actually one of the areas, first of all, I want to be able to acknowledge that Michael have put a couple of comments actually in the question answer, and he's actually the delegate for the HOD for the OMSS, and he actually has some really good comments in there regarding that. I spoke from an employed physician section, but as John noted, he's independent. Right. And, so the OMSS represents every one of those. And when Anjali was talking about work that the OMSS does, where we talk about things like policy and actually protecting physicians and patients, we really work towards hospital safety. So, one of the things that we try to do in our summary in our meetings, when we talk about the interim meetings, and we also talk about the annual meetings, is present resolutions. And so I think we're able to really talk about some of the resolutions that we had. We had 3 main resolutions that came out of the section that went to the House, and they did address where physicians are, the importance of physicians within the hospital and healthcare system, and med staff, talking about patient safety and physician safety regarding, believe it or not, mattress safety. I know people don't think that those are things that you want to think about, but these are things that really are highly important when it comes to being able in your workplace. And then also supervision, the relationship that we have with non-physician providers as well as physicians. So these are some of the resolutions that we worked on at the interim meeting that we talked about at the OMSS level. And we wanted them to go to the House of Delegates, which they did. And then the last part of it talks about what happens at the House of Delegates. So actually, it was really nice to have Matt Gold, who is a delegate and works with me. I am the alternate delegate for OMSS to the House of Delegates, to be able to represent what our membership wants to do for med staff. That is just a small part of how we actually work at the OMSS and what we do when we go to these meetings. Like John says, sometimes people ask, like, so you belong in the section, like, what does that mean within the House? And this is the type of work that we actually do.
Nancy, I loved kind of that overview. And I know you kind of skimmed over all the resolutions that we were working on. But I know that one of the things that makes me so proud to be an OMSS is how you guys kind of advocate for our safety, not just the patients, but physicians too. I remember we talked a little bit about that at the last meeting, and I was wondering if you could just expand on that a little bit.
Absolutely. So, when we actually, we were going to maybe bring up a little bit later, but this might actually be a great point where we talk about actually some of the educational information we get, because that kind of almost flows directly in. I know we were going to talk about some of the other, we could talk about the resolution number 3, which is actually the one about if you pull up the other slide, the resolution number 3, if you could show everybody what I'm talking about, where we were talking about the 3 of them with the mattress safety. And then when we actually talk about the relationship between non-physician providers and by physicians, we're actually talking about being able to make sure that not only that patients have access, but that they are able to have full scope of services at their place of access, and being able to have the highest quality of care for them, and they're obtaining that professional recognition for medical service professionals, and being able to have a relationship between non-physician providers and physicians, and being able to comment to that and provide a framework around that. Shows one of our aims and missions about how we interrelate with health systems and also with the other people who work within the healthcare system. So having said that, one of the educational components of the meeting was actually talking about workplace. We were talking about workplace safety with that mattress safety, but also I know we had a couple really good informational sessions, and I didn't know if Anjali, if you want to talk to that a little bit, like your perspective of how you took that in.
Yeah, thanks, Nancy. I think one of the questions is that there can be so much information that's coming at us all the time. It's hard to get it from experts with some real depth behind it. I know John might have a question too, but we also have a guest speaker to tell us a little bit more about some of those education sessions. So John, I wanted to kind of turn it over to you to maybe introduce our special guest.
All right, this is a longtime colleague of the OMSS. We're glad to have him back, David Welch. Good to see you, sir. And I know you were on the panel that talked about violence against physicians. So I want you to tell us a little bit what y'all talked about at that meeting.
Well, as this group well knows, it was mentioned earlier that both quality and safety is important to the organized medical staff, and it's our responsibility as organized medical staff. And we looked at some of the challenges that we are having in big city hospitals and rural hospitals. We've had people who were injured. We've had people who were killed over care that was rendered, even though care was appropriate. We're all dealing a lot with substance use disorder. We've had colleagues who have been hurt and killed over getting prescriptions or not for themselves or their loved ones. And we talked about some of the things that are being done at different hospitals across the country. In some cases, they're having to resort to metal detectors. Other cases, they're putting up bulletproof glass and special locks. And I know I'm in a rural setting. I go to 3 critical access hospitals. And quite frankly, they have to keep things tied up pretty tight with special locks, and they only bring so many people back at a time. In Cincinnati, for instance, they have to pay attention who's in their ICU. If there's multiple people from different gangs, they have to close their waiting room to the ICU to avoid problems. A lot of hospitals are dealing with, they do a pretty good job in the emergency department, but what happens when you get outside the emergency department? They need to have security to help keep staff safe. In some cases, they're doing self-defense courses. So if you get yourself being attacked, that you try to save your life or save the life of a colleague. In some cases, they have panic buttons. I actually have those in my office in a rural setting. You think you wouldn't have to worry about it as much, but it's in the rural setting, just like the city setting. It's our responsibility to make sure that we keep our colleagues safe and the patients safe. If you are, think of it this way: if you're the surgeon on call and you're on call all day or all weekend, if you get injured, who's going to take care of the other surgical patients? It can be a real problem. If a nurse nurses are hurt trying to get to the OR to help, or nurses in the emergency department to help, you can't just pull somebody in quickly, which means patients suffer if our staff is not kept safe. One of the things that did come up that was very interesting, and we don't think about it a lot, is stalking. Stalking has injuries, and we presented a case of a trauma surgeon who had been stalked through 3 states. And we came up with some recommendations about how you can help make things safer for our colleagues. Some places like to post pictures of particularly young physicians. Well, that may not be such a good idea if you have a young physician who's attractive. You may not want to put that across social media because that can attract some nefarious folks. And also, when the new doc comes in town, you plaster it all over the place. Dr. Jones is here and is going to help you in this area of specialty. Well, you may not want to. You want to be careful how you do that, because if Dr. Jones just left Massachusetts and now is in California, depending on how you present that, you're now inviting folks who were maybe following them a little too closely in Massachusetts to follow them in California. And that's exactly what happened in the case of the patient that was presented. And we discussed, folks, one of the speakers was from Geisinger Clinic, and they were doing some really innovative work to keep their hospital safe and to keep their staff safe. But it really comes down to the organized medical staff. It's our responsibility, not just to keep the patients safe, but to keep physicians safe and to keep other staff members safe. In my own small town, we had to call in law enforcement to the recovery room because someone who had, let's just say he had more things on board in his system than he let them know in the emergency department. So it took everybody and some more to try to restrain that person to keep from hurting themselves and others in attendance. There's cases of family doctors who used to do OB, but they stopped because they were being threatened, because people didn't like an outcome. It was no fault of their own, but that happens. In Atlanta a couple of years ago, we had people who were, someone came in and shot up a floor because they didn't like the way a relative was treated the year before. And the ironic twist was nobody on the floor that day had anything to do with that relative's care. So we've got folks that are doing some really bad acts out there, and we need to take that in consideration. And the group really gave examples of places that are doing it well. And we also had something along the same lines I mentioned about training for self-defense. A couple of years ago, OMSS had a program on self-defense and things that you can do for yourself if you're attacked in the hospital, in the on the way to the parking lot, wherever it might be, because unfortunately people are not acting very well out in public in general, and specifically to our healthcare colleagues.
Well, thanks, David. That is really sobering to hear. And I know that our educational program is well attended, and we had three other colleagues with you discussing this. And it's sad that we're trying to help people and we have to worry about our own safety. But it's something that I'm glad we brought to everyone's attention, and we need to keep working at keeping our physicians and our colleagues safe as possible, along with our patients. I appreciate you joining us. Thanks. Any other comments, David?
Well, I would ask the folks that are online, if you have ideas for educational programs that you'd like to see OMSS work on, to let us know. Education as well as advocacy for organized medical staff is a key part of our history. And we could go down the list of things that OMSS has done from an educational standpoint, not just safety. There's a webinar for information on disruptive behavior and how to deal with it, and how to protect yourself from being accused of that. We have a long historic list of really good educational programs. But if there's something that our group would like to hear more about, OMSS is always there to help. Our Facebook hashtag is OMSS helps, and education is just one of the areas. But I would encourage everyone to find out what is being done at your hospital for your safety and the safety of the staff. If you do not have things in place, please sit down with the other stakeholders, the folks in lab, the folks in radiology, the folks in the emergency department, to find out how you can make your workplace safer for you and your colleagues.
Thank you, sir.
Thank you.
And John, I just wanted to say before Dave signs off that actually one of the great things I have found over the last few years, even though I said policy was the first thing that attracted me, the amount of education you get through these section meetings. When people ask us, like I talked about the policy perspective of, the interim meeting, but what Dave did was just like summarize a couple of the great educational takeaways that I didn't know about, like not only the breadth and depth of what happens in workplace violence when you talk about working in healthcare, but also what innovative techniques have been done throughout the nation. And both the AMA and the OMSS does such a great job of providing that information. So like you get these key little nuggets and you're like, oh, I need to see if that's available, or ooh, like, maybe I can try to get that done. It goes just on this whole list of things that I think about when I leave these meetings. They don't always get done, but it's definitely food for thought. It's very aspirational. So I love the fact that Dave was able to encompass and show some of that. But there is so much more behind it that people don't realize or are available for them. So, thank you. I agree with John. Thanks for popping up, Dave. We really appreciate that.
Yeah, thanks.
Thank you for having me. Keep up the good work.
Yeah, Nancy, what you just said reminds me of something that I've really learned in OMSS is that medical staff bylaws aren't the evil thing I thought they were. And with Libby Snelson's lectures and webinars in the last few years, I've really appreciated how well-written bylaws and medical staff bylaws can protect our physician colleagues from notorious, nefarious organizations out there, administrations that would like to control us and kind of tear us down. And, I think my education in medical staff bylaws is just going to continue. And it's just so nice to have somebody that can present it in such a easy to understand way too. So if you never heard Libby Snelson talk, we have her a lot, and anytime she's talking, I'm always there.
And once again, one of her little nuggets that I take away is know your bylaws and get involved. You think like the bylaws committee of your med staff is like, oh my God, who wants to be on the bylaws committee, right? And then you realize the amount of leverage and power they could have for you. I mean, Angelique's story is like a perfect example of that, right? Like knowing what your med staff bylaws and how other people can leverage that against you, or how you can use that as your strength, I think is one of the lessons I've learned from OMSS for sure.
Yeah. All right. Through this presentation, we've been answering questions. I don't see any other questions, so I think we're going to go on. Nancy, would you like to start talking about some takeaways?
Sure. So one of I think we've kind of mentioned over, the bit of this event that, all the opportunities that are available for members if they become involved in OMSS. When we talk about policy, we talk about education, but, we also provide a lot of resources for both you and your med staff. The bylaws draft that we talked about, there's actually a whole publication regarding that. We actually have publications about model employment contracts. If you were interested in exactly how what we feel like the OMS has to offer you, both that mission statement that we put up, as well as the, how we go about doing it, working with accrediting bodies, working with health systems, bridging between employed, independent, and the healthcare system, what we do for that, that's in our elevator pitch link. But having said that, I think what we would like to know from the people who are here tonight, like, how would you like to be involved? What do you think would attract you to be an OMSS member? Have you thought about it? Do you think you could want to represent your hospital or your healthcare system? Is there somebody already there who's doing it and you want to connect with them and be able to do work with them? I think those are a couple of takeaways that you can do. And the second one is really like, come, like our educational events, they're open to everybody who's an AMA member. They're not open just to OMSS people. So, if you see any of our educational events and you're like, wow, the things that they were talking about, that really applies to what we do in practice or what we do in our hospital on our med staff. We would love for you to be able to come in and join us and engage with us. And like Dave said, if you think of things that you want to push forward and you just didn't know where to start, like, where do I start that? Like, how do these people come up with these resolutions? That was one of my questions when I first joined. We are more than happy to have you. We'd be open to having you reach out to us and being able to do that. Matt Gold, who I mentioned earlier, is a delegate. Like, he loves writing resolutions. So if you have an idea, you can send it his way, and he would love to open that up for you and show you how to do that. So those are some of I feel, John, I would want people to take away from our little event.
Yeah, I think Matt's going to love that. He's going to get a bunch of emails tonight and start working on the resolutions as soon as possible. But just to wrap up, I appreciate you guys joining us. This is recorded and it will be available later. Our next meeting will be in Chicago on June 9th. So if you haven't registered or you haven't made your plans, start doing it now. It's going to come quick. Y'all have a good night. Bye-bye.
Good night, everybody. Thanks a lot. Great talking to you.
Have a great night.